This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Jonathan Goldman, Director of Clinical Trials and Thoracic Oncology, Associate Director of Drug Development at UCLA in our hometown, LA. Hi,
Thanks
Dr.
very
Goldman.
much. It's always a pleasure to speak with you.
Well, I was so pleased. I was looking through the program and I saw that you're doing a poster session here, and I'm very glad that you could take time out to talk to us about what you're presenting.
It's my pleasure. It's an exciting year, and I've had the pleasure and honor of being part of a few trials that I think are really moving things forward. The poster that you're speaking of is an antibody against a receptor on cancer cells called MET. MET sort of entered our understanding of cancer development just a few years ago. Initially, it looked to be, within lung cancer, most important in patients with EGFR mutations. But actually, maybe the story is even larger than that. We are looking at a variety of ways of affecting and improving cancer treatment by targeting MET by itself, with Tarceva, with chemotherapy. And the trial that I discussed today was a trial of an antibody that is, I guess, the second antibody in this class. It's different in that we think we'll be able to block MET through two different pathways, and that may be important. And we're hoping to find, in this particular case, that we can make Tarceva work better. We know that Tarceva works for the right population of patients quite well, but it doesn't work as long as we would like it to. One possibility is that adding a MET inhibitor at the beginning is going to prevent resistance. Another possibility is you wait until resistance develops, you add in the drug, and you get a good benefit again. And this trial laid the groundwork for those trials that are yet to come.
How many pathways have we thus far identified in lung cancer?
It's really getting dizzying, as I think you're suggesting. We have two that are particularly well delineated, EGFR and ALK, but we also know and have known about KRAS for a long time, but the list has grown. Now we're probably at least 10. And this is just an adenocarcinoma, another 5 or 6 in squamous cell, and certainly every year several new ones are described.
Thank you, Dr. Jonathan Goldman, Director of Clinical Trials and Thoracic Oncology, Associate Director of Drug Development at UCLA.
Thanks very much, Selma.
Pleasure.